Resuscitation and Emergency Procedures Training in Semester 10. A comprehensive explanation. Resuscitation and emergency procedures training is a vital component taught during the 10th semester of medical education. The primary goal of this training is to prepare medical students to handle emergency situations quickly, accurately, and effectively, both within healthcare facilities and in pre-hospital settings. Students are trained to master theoretical knowledge, technical skills, and clinical decision-making in medical emergencies. 1. The importance of resuscitation and emergency procedures training. 1. Patient safety. Quick resuscitation and appropriate emergency actions can save lives. Effective initial management significantly increases the chances of patient recovery. 2. Essential doctor competency. Competence in emergency care is a fundamental requirement for every doctor. Students are expected to deliver emergency care in various conditions, including resource-limited settings. 3. Handling complex cases. Through this training, students are equipped to manage diverse emergencies, such as cardiac arrest, severe trauma, and pediatric or maternal emergencies. 2. Key components of resuscitation and emergency procedures training. A cardiopulmonary resuscitation, CPR. 1. CPR basics. Focus on ABC, airway, breathing, circulation, techniques to maintain airway patency, provide artificial ventilation, and perform chest compressions. 2. Adult CPR. Chest compressions at a rate of 100 to 120 per minute, with a depth of 5 to 6 centimeters. Compression to ventilation ratio, 30 to 2 for manual CPR without devices. 3. Pediatric and infant CPR. Techniques and ratios adjusted for smaller body sizes. Emphasis on gentler pressure and smaller ventilation volumes. 4. Automated external defibrillator, AED, use. Students learn how to operate AEDs to deliver electric shocks in cases of cardiac arrest. B. Emergency airway management. 1. Airway opening techniques. Head tilt, chin lift, for patients without suspected neck injury. Jaw thrust, used for patients with potential neck trauma. 2. Airway management with equipment. Use of ambu bags, laryngoscopes, and endotracheal intubation. Management of airway obstruction caused by foreign bodies, e.g., Heimlich maneuver. C. Trauma emergency management. 1. Head and neck injury management. Cervical spine stabilization to prevent further injury. Neurological assessment using the Glasgow Coma Scale, GCS. 2. Hemorrhage control. Manage external bleeding with direct pressure, pressure dressings, or tourniquets. Intravenous fluid replacement to maintain hemodynamic stability. 3. Thoracic trauma management. handling pneumothorax, needle decompression or chest tube insertion, management of cardiac tamponade. 4. Abdominal trauma management, identifying internal bleeding and stabilizing patients before surgery. D. Cardiovascular emergencies. 1. Heart attack, acute myocardial infarction, identifying symptoms, chest pain, shortness of breath and sweating. Initial therapy, nitroglycerin, aspirin, and oxygen administration. 2. Arrhythmias and cardiac arrest, managing bradycardia and tachycardia with medications or defibrillation. E. Pediatric and infant emergencies. 1. Neonatal resuscitation, ventilation and compression techniques tailored for newborns. Apgar score evaluation for initial condition assessment. 2. Febrile seizures, managing seizures with rectal diazepam or intravenous medication. Managing hyperthermia with antipyretics and compresses. F. Obstetric emergencies. 1. Postpartum hemorrhage, administering oxytocin to promote uterine contraction. Managing hypovolemic shock through fluid resuscitation. 2. Eclampsia, administering magnesium sulfate and antihypertensives. G. Environmental emergency management. 1. Burns, initial treatment with fluid replacement using the Parkland formula. Preventing infection in burn wounds. 2. Hyperthermia and hypothermia, management based on the patient's environmental condition, cooling or warming. 3. Poisoning, identifying the toxin based on symptoms. Administering specific antidotes when available. 3. Training methods. 1. Simulations and hands-on practice. Students practice using mannequins or other assistive devices. Repeated training is conducted to build confidence and technical skills. 2. Case-based learning, CBL. Students analyze emergency cases and discuss appropriate management solutions. 3. Scenario-based training. Training uses emergency scenarios to train quick decision-making. 4. Evaluation and feedback. Each action performed by students is evaluated by instructors, who provide constructive feedback for improvement. 4. Challenges and solutions in training. 1. Emotional pressure. Students are trained to remain calm and focused in emergency situations through repeated practice. 2. Team coordination. Training involves teamwork to ensure effective communication and efficient action. 3. Resource limitations. Students learn improvisation techniques for managing emergencies in resource-limited settings. 5. Final goals of the training. 1. Clinical competence. Students are expected to perform resuscitation and emergency procedures according to protocol standards. 2. Rapid decision-making. Students should prioritize actions effectively in life-threatening situations. 3. Readiness for independent practice. This training prepares students to handle emergencies independently after becoming doctors. Conclusion: Resuscitation and emergency procedures training in Semester 10 is a critical component of medical education. This training aims to equip students with the skills and confidence to handle medical emergencies professionally. Through intensive training, case simulations, and continuous evaluation, students are expected to provide effective emergency care and save lives in a variety of conditions.